I want to welcome you to our Thursday press briefing with updates on COVID-19. As of this morning, we have lost almost 130 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Some days I wonder what I will have to say on a Tuesday or Thursday. And today, I hope I don't bore anyone, but basically, I want us to collectively consider where we are and where we are going. There are different measures for deciding when the economy should be reopened. And I think that generally means when we should start returning back to our normal routines. I, some time ago, consulted the World Health Organization. They set forth 6 criteria, and I want to discuss those in connection with where we are here in Albany and where we will be going in the next few weeks. The first is that the disease transmission is under control. I would put a question mark here. However, the news, as you have heard in the last 2 weeks, is very encouraging. The trends are positive. But we still have 54 COVID patients in our hospitals. That is a matter of concern. But when you compare that with the fact that only a few weeks ago we had almost 3 times that many COVID patients, you see where we have made remarkable progress. What we cannot lose sight of is this. In normal times, these 54 beds would be accommodating other patients. We know this from what the staff at Phoebe has told us. In recent weeks, there has been an increased number of admissions, and this has been attributed to the fact that some people were afraid to seek medical attention at the hospital because they were concerned that they might contract the virus. Back to number 1, disease transmission is under control. We are testing people at the district office of the Department of Public Health and at the National Guard website, at the National Guard testing site behind the Civic Center. Likewise, Phoebe Putney is testing every patient in the hospital as a precaution. What is encouraging here is that less than 10% of the patients who are now being tested are testing positive. That's also a matter of concern, because what does it tell us? It confirms the virus continues to spread here in our community. Also, under disease transmission is under control, we are seeing a significant decline in the admission of COVID patients at our hospital. Phoebe Putney, in recent days, has been discharging more COVID patients than have been admitted. But, as I said, with the broader testing, we are still seeing there are positive results, meaning more people are being infected. We also have 54 COVID patients in the hospital. And most alarmingly, we have 30 of our friends and neighbors, our brothers and sisters who are on ventilators. And we know that the prognosis for these patients is generally poor. The second criteria is that health systems must be able to detect, test, isolate, and treat each and every case and trace every contact. You've heard by now what contact tracing is. You track and isolate those who may be affected. What you're doing is you're keeping those who may have been exposed to the virus from exposing other people. We in Albany and Dougherty County were unable to adequately contact trace because of the sudden and rapid spread that we experienced here in March and early April. However, we've heard from Dr. Ruiz that the Department of Public Health is training some 300 or 400 healthcare professionals who will be available for contact tracing. So in the event there is a rebound or a second wave, as the case may be, and now I understand that here's another term like isolate and quarantine, I thought were synonyms, but they actually mean two different things. Both would be unfavorable developments because they refer to the return of the virus. We know now that we have better testing. In the early days, we had a limited number of testing kits. And as you may recall, only those people who exhibited the symptoms were being tested. As a result, there was a high probability that many of these people would test positive. The third criteria is hotspot risk are minimized in vulnerable places, such as nursing homes. But we also know vulnerable places could be meat packing plants, correctional facilities, prisons. We are very fortunate here in Albany and Dougherty County that no one, to my knowledge, has been infected in the Dougherty County Jail, and the Sheriff's Office is to be commended for that. But precautions have been taken in nursing homes throughout the state, and particularly here in Southwest Georgia. We know that at least 2 nursing homes here in Albany have experienced number of residents having been tested positive, and Mr. Fowler will give us the deaths. I think some 33 of our residents were residing in nursing homes at the time of their death. We know that these people fall within the category of those who are most vulnerable. What the Department of Public Health has been doing is they have had experts working with the staffs of nursing homes to advise them in best practices to protect their residents and themselves from infection. The fourth criteria is these last 3 we're working through. Schools, workplaces, and other essential places have established preventative measures. Okay, the school system has monumental challenges in the months to come. We were on a conference call this morning, and one of the ministers expressed concern, sought some guidance on how you implement social distancing and other precautions with toddlers and young children. That is something that we're working through. However, there are resources out there. I advised the public earlier this week that on the city website we would have guidelines. GMA has issued guidelines for best practices, and we're going to have that on the city website. There's some uncertainty, but as restaurants reopen, as bars and gyms reopen, I think that our citizens are taking every precaution, and I want to commend them for doing so. However, we all need guidelines. Mr. Fowler will speak later about some uncertainty regarding funerals and graveside services. We know this. While there may not be a maximum number of attendees at 10, we know that all individuals must maintain social distancing. We have talked with our clergy, and I have learned much in these discussions. One thing that came up today is individuals in a choir can infect one another. Singing is one way that people can infect others. Another thing that came out that should have been common sense to me, but I didn't realize it. When you have an HVAC system, you're circulating air. So if one person is infected, even if you're exercising social distancing, that air is going to be circulated throughout the sanctuary. And one precaution that was recommended by one of the ministers this morning is a device you put on the HVAC system that basically screens viruses and germs. It is, I understand, utilized in hospitals and other hyper clean environments. Fifth, the risk of importing new cases can be managed. What we have now, at the beginning, our healthcare workers did not have sufficient PPE. We were concerned that there might not be enough ventilators to accommodate the patients who are in respiratory distress. We had questions about the adequate or efficient isolation protocols. Now we have early case recognition. We have more information about the disease, which Mr. Steiner said some weeks ago is an invaluable tool for healthcare professionals. We know that with the ability to contact trace, rather than quarantine the entire community, what we will be able to do is identify the clusters of those people who have been exposed or infected and isolate them. I think we do have clearly an enhanced ability to cope with the second outbreak, whether it be a rebound or a second wave. Sixth is this: communities must be fully educated and engaged in the eventual lifting of restrictions to assure they are empowered to live under this term we all have heard too many times, the new normal. Well, what this is whatever the next few months hold, we're going to continue to social distance. We should continue to wear face coverings when we're in public. We should continue to disinfect surfaces throughout the day. We know the additional requirements that have been imposed upon restaurants and barbershops and beauty shops, other businesses. We are asking retailers to implement additional precautions over what they're required to do. And we've discussed, but I don't think it's happened, setting aside hours for those who are particularly vulnerable. And in closing, I want to say this. This pandemic has exposed an inequality we all knew existed, that those who live in poverty and African Americans have poor health outcomes. This is something we as a society have to address and do something about. Likewise, from where I sit, we as a nation do not need to rely on pharmaceuticals and personal protective equipment and other equipment to be imported. We should be producing this ourselves. We should encourage people to work as nurses and first responders. And in closing, I want to say something that I mentioned weeks ago. After all this is said and done, let's continue to hold these healthcare professionals in high regard. There is a term, redistribution of respect. But not only healthcare professionals, first responders, emergency medical technicians, and I have mentioned before, those individuals who work in the city's public works department, who have continued to maintain our properties, those who have continued to pick up our refuse, and those who work for Albany Utilities to make sure throughout this ordeal our lights are on, we have water, and our police officers who assure that there is order and we can live lives of safety. Thank you.
Thank you, Mr. Mayor, for your comments today. Now we will hear from Dougherty County Commission Chair Christopher Cohelas.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by expressing my sincere condolences to the nearly 130 families that have lost loved ones. We continue to pray for you each day. I want to talk today about where we have been, where we are now, and where we are going, because I think it's very important in terms of plotting a course of progress that you recognize what your history is, what your present is, and where you're going to go. The reality is this: we do not know as a nation, as a globe, as a world economy, what this is going to look like 6, 12, 18, 24 months from now. In fact, I've seen different opinions from different public health officials all over the world, and the one thing is consistent is that no one is consistent. The reality is this, we know this, we're going to have a different normal moving forward. What we do also know is this, we got and received a tremendous amount, a tremendous influx of this infection all at one time in this community. I want everyone to understand, appreciate, and imagine what it was, what it looked like for our community in those past several weeks when you literally had an overcrowded hospital, exhausted healthcare workers, EMTs that are working around the clock, doing 30, 40% more calls than they ever normally do, having healthcare workers, while they're also working 16, 18-hour shifts, having to also be tested and worry about and absorb the anxiety about whether or not they themselves have been infected. We've all had to learn about this virus very quickly. We've had to understand and appreciate that up to 80% of the people that actually contract the virus never actually know that they have it. We overcame tremendous odds by taking tremendous, swift, decisive action, not only at the executive level, but at the community level. And we have flattened the curve in many, many ways. Is that to say that the drill is finished? No, it's not. I've said this, and I will continue to say this again and again and again. This is not a sprint. It is a marathon. And each day, though we are in a far better place than we were 2 or 3 weeks ago, and to put that into a picture, earlier this week we were thankful to have the governor come down and tour the COVID-19 surge facility that literally has been built at Phoebe North, where literally up to 26 patients, additional patients, can be treated there in the event that we see a second rise of the virus. This is not an acute event where it's going to go away overnight. We are going to continue to see people that are going to be infected in this community. We are going to continue to see people that are infected across the state, across the region, across the globe. That is the nature of this virus. What we can do is best protect those that are medically fragile, those that are at the highest risk. And we can also take precautions as a community to make sure that those that don't fall into those categories are still engaged in life and in business in a way that is most conducive to not spreading to the virus to those that are more vulnerable or to other people. How do we do that? We do that by wearing masks. We do that by continuing to social distance. What I also know is this. Albany at one time was number 3 in the world, behind the Wuhan province, behind the Lombardy region of Italy, and now it has flattened the curve faster, I would say, than any other comparable community that I've seen. And maybe there's some folks that could disagree with those statistics, but at least from my observation, that's what we've done. But we have to continue to work because this is a marathon and not a sprint, and we have to begin defining how we move forward from here, because I will say this, it is completely unsustainable for us to shut down the entire world because we are in panic and in fear. We have to begin defining the way that we re-enter the world, the way we re-enter certain services, certain businesses in a measured approach. We have to be able to do that, and it means it is most safe for everyone. Because if we continue at this rate, I mean, the number of people that are out of work and unable to support their families is staggering. And to the mayor's point as well, like living in fear literally causes people to not go and get necessary medical care at the hospital when they need it. I'm not at all suggesting that it is the time for us to open the floodgates or do anything of that sort. What I'm suggesting to everyone, to our business community, to our citizens is I want you to start thinking about what are the things that we can do as we know the governor's order has relaxed some of the restrictions. What are the things that we can do in our daily habits that can continue to protect us and protect our fellow citizens? Some of the things that I'm thinking about at the executive level, what are some of the things that we can request to better assess where we are as a community? When the governor was down here earlier this week, one of the things I inquired about is antibody testing. Like, I want to be able to know, and I'm not sure if we're going to be able to gain this resource or not, I want to know how many people in this community have the antibody, how many people have had the virus, have overcome it, and have some level of immunity. And I don't know the answer to whether or not you're permanently immune, you're temporarily immune, or what have you. I also have heard terms such as herd immunity, where certain communities can actually develop strength because some communities have had so many people overcome the virus that they become stronger as a community. I don't know the answers to all of these questions, but these are the types of questions that I'm asking at my level so that I can make decisions that are hopefully the best for everyone. And on the micro level, on the little picture level, I want us all to be thinking about these things. When you're going to a business, are they engaged in good practices or not? I want to applaud the businesses that have decided to reopen and do so in a conscientious manner. I've heard great reports about barbershops and the people wearing masks and taking every single precaution possible. And I've also noticed that this is occurring at the same time that we're continuing to see the numbers flatten. Because 3 weeks ago, the mayor's absolutely right. It was nearly 3 times that was in Phoebe. And the number of people on respirators was well above 70, if I remember correctly. And we also know that many of those people on respirators are not going to make it. And what we need to do is continue to lessen the number of people that are getting on respirators, because we don't want to see that happen. And we also have to figure out a way to continue to recover as a bigger, a stronger Albany and Daugherty County, because what we're doing here literally impacts how other communities are deciding to approach this, because no other community in the state of Georgia, and I would say, at least according to the New York Times, at one time, we were in a worse position than New York. So they're literally looking to how we're doing things here, and we have flattened the curve. We have to continue to do that. I've been very impressed by our church community for making so many reasonable decisions as to, in light of what you can do or what you should do. Some have chosen to continue to push online services. Some have continued to say, you know what, our population is still too vulnerable. We're going to service them through online. We have a church where it's too small for us to appropriately social distance, so we're going to stay closed for another month and service people that way. And so these are the types of decisions that we want to encourage everyone, because what you can do is just follow the letter of the law, or you can follow what is the right thing for you and your community. And those are intensely personal decisions that have to be made at the personal level, the family level, at the business level, the church level. And they depend on a variety of factors. You know, if your business services a large number of elderly people, think about creative and new ways that you can provide that service or that good to them in a way that doesn't create a lot of contact. These are the types of things that we're going to have to be innovative about as we move forward, because I will say this, it is unsustainable for this community to continue to suffer the tremendous amount of economic harm that it is continuing to suffer each and every day. And I don't mean that in terms of dollars and cents for the city or the county. I'm talking about the people that can't put food on the table. I'm talking about the jobs that are lost, the people that literally have no pride or purpose at this time. We have to start thinking about these things if we're going to move forward successfully. And that's very important, because we can either define our future or we can react to what others dictate for us. And I think it's very, very important for us to define our own future. There's been a lot of questions about funerals, and as I understand the governor's order, this is what I understand. And if someone needs to correct me, then so be it. You can have 10 people at a funeral or more. You can have 10 in a gathering. Everyone is encouraged to wear a mask and social distance. But if you're going to have more than 10, you absolutely have to have social distancing. That's incredibly important. And we know that funerals are emotional events. And we've had, God bless, far too many funerals in this community. And what I don't want is one funeral begetting another funeral, and another funeral, and another funeral, and another funeral. And we have seen that happen through no fault of anyone's, because no one has done anything wrong. And the grieving process is very real. But these are the types of things that have to be as we move forward. And we were providing guidance today with respect to our churches about the types of things that they need to think about as they move forward. As it relates to funerals, yes, you can have more than 10 people there, but you absolutely have to have social distancing. And I call upon all of our funeral homes, all of our pastors, and all the parishioners of everyone's church, wear a mask. I am not a scientist. I'm not an epidemiologist, but I know what I know, and I know what I've seen as I've been in the thick of this every single day. Masks are helping. And we are living a lifestyle that is far different than the lifestyle that was existing when this ghost gripped us, moved amongst us, and attacked us. So we have a lot of things that have changed the culture of the way that we deal with the world, the way we deal with each other, that are good things in combating this virus. And I want us to continue to be innovative as we move forward. Additionally, get tested. Please get tested. Well, let's take advantage of this resource that we have through partnership with the Governor's Office, the National Guard, the Department of Public Health, and Augusta University. I don't care if we make them run out of tests. I think that's the best thing in the world, because the best thing that we can have at this time is data and demand for tests. Because I will say this, if you don't take advantage of a resource, it can go away. And how you define a solution is by appropriately identifying the problem. We have access to a tremendous resource. We need to take advantage of it. Go ahead, call, use the app, make an appointment, or drive up there and sit in line. And I want to dispel the rumor, the myth, the urban legend that's been out there that somehow by getting tested, you're going to get exposed to the virus. That's hogwash. Absolute hogwash. Please get tested. Find out if you have it or if you don't. Make decisions based upon that for the safety of you, your family, your loved ones, your elderly family members, and those you come into contact with. That's incredibly important. A reminder, the governor's shelter-in-place order expired on April 30th. However, that continues for medically fragile persons through June 12th. Medically fragile and elderly Georgians must continue to shelter in place. And I want to thank the governor's office for coming down earlier this week, viewing the facility that we now have available after we have flattened the curve, and for making himself available to us as we continue to ask for more resources. And I want to say this again. We have gotten resources in this community that many other communities have not. And I'm very thankful for those, but that doesn't mean that I'm going to be bashful about asking for more. We're going to continue to aggressively ask for more and more and more resources for this community on a forward-moving basis so that we can tailor a solution to our problems and define our future. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear an update from Phoebe Putney Memorial Hospital. The Chief Medical Information Officer for Phoebe Putney Health System is with us today, Dr. Bill Sewell. We welcome Dr. Sewell back with us. He was here at the very beginning, and we're happy to have you back today for an update. Thank you.
Good afternoon, you all. I just have a few brief comments, but one that's not prepared. As I sat here in the audience, I'm impressed, and the entire community should be impressed with Mayor Durr's and Commissioner Cohilas's commitment to understand this pandemic and the way in which they've each educated themselves to help take care of our community. I mean, it's really nothing short of amazing the level of knowledge they've gained about this, as we all have. But not being scientists, they have really dug in and learned a lot about this, and I, for one, appreciate that. As several of these things have already been mentioned, but I'm very happy to report that we've had single digits of admissions to Phoebe Putnam Memorial Hospital for actually well over 2 weeks. And this has led to us only having 54 patients in the hospital, both at Phoebe Main and Phoebe North. That number remains stable between yesterday and today, which actually means we discharged just as many patients with COVID-19 as we admitted. That's a good place to be. We want to get it to where we're discharging more than we're admitting, but we'll take baby steps to get there. The modular unit did open yesterday, just as behind Phoebe North, just as we'd planned. There are patients in there now being actively treated, and seems to be functioning very well. And then the last thing that we need to take note of is that we're closely measuring those numbers of admissions every day, and you should be aware of that. We'd gotten it down to a very small single-digit number, but over the last week or so, it started to climb slightly. We're still in single digits. That's great. There's going to be bumps. I mean, I think you would have to expect bumps along the road like this, but it is starting to climb, and just know that we'll be watching that every single day. And if it starts to resurge, I suppose there's two different terms. Rebound is just get a little bit higher. Resurge is to take that straight up trajectory like we had back in early to mid-March. But we will be happy to let the community, or we will be certain to let the community know as soon as we see any trend like that. Thank you.
Again, thank you, Dr. Sewell. We will now have an update from Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. I want to give you a few updates and give you some figures of some of the stacks that's going on. Thank our mayor and our chairman and Doc for the information they have given out. As of today, our count is 127. We have a total of 127 positive deaths that had been tested, and maybe they might have been tested at Phoebe, or might have been tested from the Department of Public Health, and also maybe from the Georgia Bureau of Investigation, but all 27 have been tested positive here, residents in Dougherty County. We had 125 Tuesday, and we have two more. You said two more, but one was a late interest that happened really the week before, and I'll go through that in a minute. As of today, we have a total of 17 in 31721 deaths. 31707, we have a total of 26 deaths. 31705, we have a total of 28. Tuesday, we had 27, so we had one more death that was from a following week that we found that was not listed on the list. So we have 28 in 31705. In the south side, we had 55, but now we have 56. That was just one more death this week we've had. From Sunday to now, we have just had just one death. And I thank God for that. Females, we have a total of 69. Males, we have a total of 58. 1 Latino as far as race. We have 28 whites, 27 whites. We have 99 black. We have 1 Latino male. We have 19 white females. We have 8 white males. We have a total of 50 black females. We have a total of 49 black males. Based on age, we have 10 that was in the age of 90. We have 24 was in the age of 80. We have a total of 35 in the age of 70. We have a total of 40 in the age of 60. We have 7 in the age of 50. We have 8 in the age of 40, and we have 3 in the age of 30. The average age is still 71. Based on death or location, where the person died, we have 103 that died at one of the hospitals. We have 18 that died at the nursing home. We have 6 that died at the residence. The residents of the nursing home, we have a total of 35, 28%. Ones outside with 92, and 72%. This is a breakdown again of the weeks. March the 15th through the 21st, we have 10. March the 22nd through the 28th, we have 17. March the 29th through April the 4th, we have 29. April the 5th through the April the 11th, we have 25. And the one that was a late interest and really died April the 12th through the 18th, that was total. Last week, Tuesday we had 24, but it really is 25. April the 4th, April the 19th through April the 25th, we have a 7. April the 26th through May the 2nd, we have a total of 13. And from Sunday to now, we just have one death. I mean, that's amazing. That's just amazing. I give God the glory for that. I want to encourage you, as the mayor and the chairman have said, we have to mask up. Everyone needs to wear a mask. I know different ones, we're going to piggyback on the funerals and the different getting out into the community. As the mayor said and the chairman said, if you're going to go to a funeral, if you're going to be more than 10, you need to mask up. Whether you're going to be standing beside the cars or standing in the cemetery, you need to mask up and you need to stay this practice social distancing. That's going to be very important. We don't, as they said earlier, we do not want to have a resurgence of death to start happening. So from Sunday to now, one death, a resident here in Dougherty County. I thank God for that. I want to thank the community, the ones that have worked with us, practicing social distancing. I want to say keep on praying, keep on giving God the glory, keep on practicing social distancing, and keep on wearing your mask. They're going to be the key if we do it in that order. Thank you again.
Thank you, Coroner Fowler, for that valuable information. We will now pause and open up for any questions that anyone may have today. Okay. Hearing none, we will also remind you, if you missed any of the information today on resources that were available, of course, you can call the Emergency Operations Center at 229-302-1900 for information or numbers to testing, sites or locations. Please give us a call. We'll be happy to assist you in any way we can. This will end our press conference today, and we will see you again on Tuesday at 1 p.m. Thank you.